host, coming at you from Breckenridge, Colorado. Today on the show we have Shane LeMaster. He's been on the show a few times in the past, and Kyle and I get to talk to him today about his experiences with ketamine as a therapeutic agent, and some of his experiences with ketamine, pretty wild stories. I'm convinced that this is a really breakthrough drug that we probably should be talking about more in the psychedelic world. Phil Wolfson presented at Horizons recently and got into a lot of the ketamine data. I believe there was another person presenting on ketamine there as well. And it's just something that we in the psychedelic movement can learn a lot from, because, it's not necessarily just you give the drug and the person's fixed, though that does appear to be the case for shorter periods of time. But doing high dose sessions with therapy attached seems to have incredibly great results. So kind of permanent sometimes too. And there's a lot of ways it could be integrated into someone's healing approach. And we get into some of that in the show. So I hope you enjoy it. Again, Shane LeMaster, mindops.com is his practice. You can check out the links in the show notes on our site. I also have a link embedded in the MP3 here. A little bit of business. We are still trying to help promote Eric Osborne from Myco Meditations with his upcoming retreat in Jamaica, which includes Shane Moss, Catherine McLean, and others, to kind of round out the experience of being in Jamaica and exploring psychedelics. So Eric does kind of a therapeutic process down there, and I believe he's one of the only, if the only, kind of gringo white guy doing mushroom sessions legally anywhere in the world that I know of, at least not in Europe. I'm sure there's some folks doing it in the Netherlands, but I'm not aware of those folks. Very great guy. He seems incredibly skilled. People come back and give great testimonies. So check that out. Myco Meditations, Google, Instagram, Facebook, all that stuff. You'll find plenty of info. And we have some past podcasts with him. So if you want more info on that, check them out. We also are still offering our course, Navigating Psychedelics. You might really appreciate doing a lot of harm reduction, education around psychedelics. Consider it a 101, 102 of psychedelics. It's like you taking a college class or a set of classes that will keep you out of harm's way. The number 1 and 2 most important things: keeping you out of the hospital and keeping you out of jail. And we teach you a lot of that. Teach you how to do some grounding, integration, and give you some context around what it might look like to go to an ayahuasca session in Peru or some other work that might be of interest to you and available somewhere in the world, if not legally, locally. Check it out, navigatingpsychedelics.teachable.com. You can also get the link off of psychedelicstoday.com. What else are we doing? Oh, just today, we launched the Ultimate Psychedelic Book Giveaway. We're giving away like 14 items, including a seat to Navigating Psychedelics. Let me read you a list of the books we're giving away here. Giving away stuff by the Shulgins, plenty of Groff books. Brotherhood of the Screaming Abyss by Dennis McKenna. LSD, My Problem Child, Reflection on Sacred Drugs, Mysticism and Science by Albert Hoffman. Psychedelic Explorer's Guide, James Fadiman. Pical by the Shulgins. Dirty Pictures about the Shulgins. LSD, Doorway to the Numinous by Groff. The Adventures of Self-Discovery by Groff. Healing Our Deepest Wounds by Groff. Ultimate Journey by Groff. When the Impossible Happens, Holotropic Breathwork, and also a Psychedelics Today t-shirt and mug. You can check out all this stuff at psychedelicstoday.com. We'll link you to it in the show notes for the episode and have a link on the main site too. So yeah, check it out. The more you share it, the more chances you have to win. So share far and wide, forums all over, and we love you for sharing. So I think that's it for now. We'll see you on the other side of the show. Thanks again for tuning in.
All right, welcome back to Psychedelics Today with Kyle and Joe. We are here with Shane LeMaster. You might remember Shane. He was previously on our show talking about microdosing, martial arts, and flow states. So I know Joe and I talked a little bit about wanting to get somebody on the show to talk about ketamine in a past episode, and Shane reached out and said he wanted to chat with us. So here you are, Shane. Thanks for coming back on.
Thanks, guys. It's good to see you.
Good to see you too.
Mm-hmm. So I guess for any listener that doesn't know your background, they could backtrack and check out our previous episodes. So let's just jump right in and ketamine. What is it? We haven't had too many people on the show to talk about it. I think we had Lex on the show, but
yeah, he talked about it a little bit, but it was more in the context of like maybe a safe thing to do at home. Because a lot of people say psychedelic therapy is really inaccessible, and I think Lex is making the argument that if you have the skills or willingness to do it, you could use these substances at home in your bed or something, minimize harm. Assuming you're doing it for the right reasons and you're not just looking to party, you're probably not going to end up in a bad state. But get educated first. But that's kind of where he was going. So what are your kind of initial impressions or like things you like to share, Shane, about ketamine when someone starts asking you about it?
Well, I'll tell you this much: not many people ask me about it. So it's fantastic to be here today with you guys and have just a venue to be able to talk about this. First impressions, if I could sum it up, I would say, ketamine is a hell of a drug. It's pretty amazing. It has a very wide range of applications for therapeutic purposes. But it's a very interesting drug in that it's different than other psychedelics in some very distinct ways, but still able to produce very strong hallucinogenic type effects and transpersonal experiences. So ketamine has always kind of been one of my, I guess, favorites for journey work that I've done. I first started experimenting with it in high school as a recreational additive to my drug arsenal when going to raves and things. So, having experienced, the K-hole back then and, taking it very much like your other guest was mentioning, laying in bed at night and developing actually a ketamine addiction at one point, but having, those were my first astral projection experiences were on ketamine. And then now later in life, having more experience with ketamine after a long break, realizing the full transpersonal and psychological potential of this drug, but still technically legal right now. It's pretty amazing.
Right. Yeah. It's what is it? A Schedule 2 drug? Schedule 3?
I believe it's Schedule 3.
Schedule 3. And so ketamine's a dissociative, correct? And it is it was originally used as an anesthetic.
Mm-hmm. Yeah, so it's considered either a dissociative anesthetic or a dissociative hypnotic. Also, it's been called that as well. And yeah, it was developed. There's a big rumor around ketamine that it's a horse tranquilizer or it's a cat tranquilizer, and it is. It's used as an anesthetic in veterinary medicine, but it was developed for human beings. The U.S. military loves this drug for their use on the battlefield, as well as in treatment-resistant PTSD therapies for vets. The VA actually funds treatment for vets through ketamine.
Oh wow!
Really?
Yeah, one of my friends, and we can talk about that too. One of my friends who's a PTSD sufferer, long time, 10 years of flashbacks and really horrible things going on in his life after combat service. 3 ketamine treatments later, and he's an entirely different man. He's come out of that dark hole.
That's outstanding.
So, yeah.
It's interesting that we're not talking about that too much because everybody's kind of all about the MDMA PTSD connection, but the fact that it is currently being used with or treated with ketamine is fascinating, and the VA is funding it.
Mm-hmm. Yeah, and if you guys have any listeners who are vets or sufferers of PTSD, I know for a fact that there's a VA clinic in San Antonio, Texas, that does ketamine therapies, and the VA will pay for veterans to fly all the way out to Texas. They'll pay for the treatments. They'll pay for them for housing and hotel room while they're there. So
Wow.
the military really loves this drug, and they love it too as a battlefield medicine too. If you think about it, someone maybe loses an arm during a firefight. If they give that person morphine to deal with the pain, that person's not walking out under their own power. They have to be carried out by 2 other guys, and that takes 3 men off the battlefield. Whereas if you give the same guy a shot of ketamine, he can walk himself off the battlefield. He doesn't have to have 2 people carry him, and his pain level is similar to that of morphine.
That's amazing. I'm actually just on Wikipedia right now, and you always got to take Wikipedia with a grain of salt from time to time, but it says it's on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in a health system. Interesting.
Yeah. With my surgeries, I've had it as part of my anesthetic cocktail a number of times. So I didn't realize I was a ketamine user till after I got the drug report after the
Do you remember any of your
the surgery? No. Apparently they're great with anesthetics up here. But yeah, it was like a whole cocktail of fentanyl, ketamine, all that stuff. It was like a really quick out and then back in. I'm sure it was like a 5 to 7 drug cocktail.
Yeah, what I've read in the literature is that for opiate addicts who can't necessarily have normal anesthetics, or else it kind of reinvigorates their addiction, ketamine can still be requested as an anesthetic for surgeries. So that's pretty cool that we can use that. And it was initially developed, from what I'm reading, in part for use in anesthetics for infants who need surgeries. And the reasoning being is that ketamine is one of the safest anesthetics because it does not depress the respiratory or the heart rate systems in the body. Those stay completely normal even on high doses. Yep. Whereas with normal anesthetics, there's a lot of overdose or people dying on the table because their heart stops or they stop breathing.
I don't have a citation on this, but from what I recall, doctors became uncomfortable with the stories patients would come back with after the surgery. Say, I don't know that I like my patients telling me about astral projection or, being way deep in a K-hole for, 6-hour surgery. Like, that's a lot. And it's I think a lot for the doctor to handle, kind of extra baggage. So they kind of shifted away from it in adult use as like a primary, at least in like the regular medical system.
Makes sense.
Yeah. So we have been, I talked to a couple clinicians at the recent Horizons conference, and what they were saying, one was actually a ketamine provider, but she exclusively does it intranasally with a spray. And she was actually kind of critical of the infusion market, especially when we're seeing a lot of that given to people intravenously, but without any kind of support or therapeutic context around it. It's kind of just like a factory, like you're in, you're out, kind of like DaVita for ketamine. I never thought about that before. That's interesting. But I don't know. Do you have any experience with people who have like been to treatment centers and like had a good time versus a bad time in terms of like therapy being provided or just turn and burn?
Yeah, I have a few friends who have gone to a variety of different ketamine clinics. Like I was mentioning before, my VA friend went to a VA clinic, and therapy was a part of the protocol. Pre-integration, and psychotherapy around the PTSD, as well as post integration therapies, and that showed great success right away, even after the first session, and lasting results too. He hasn't had it for a while, but his depression has been gone and zero flashbacks and nightmares since he had it. But I've also had friends who have gone to other lesser known centers that don't have therapy as part of their protocol, and when I talk to them, they still report a highly beneficial result as far as opening themselves to spiritually and transpersonally, but also on their mental health and addiction. They're showing positive results too, just maybe not to the same level of effect as when the therapy is involved. And I guess that's what I'm most interested in when it comes to ketamine, because I'm a therapist. I'm an a psychedelic integration therapist as well, and that's kind of my primary interest is how can we make these medicines most effective and use them for all sorts of different things.
Can you describe why this is being used in therapy? Like, what's your interest in it? How can it be like the clinical application?
Sure. Like kind of why I'm interested in using this.
Yeah, and why it's starting to pick up speed as like a clinical intervention. What it's being used for.
Yeah. So I think I'm interested in using almost any psychedelic assisted therapies, but right now ketamine is so interesting to me because it is still class 3, schedule 3. It's not as closely regulated as the schedule 1s, so it's more readily available. These clinics are around where clinical work could be implemented. But there's a number of studies that are showing great clinical results when integrating it in with psychotherapy, especially for treatment-resistant disorders. So I have a number of articles sitting here in front of me, and just off the top of my list, my personal interest right now, because I work in an opiate addiction clinic, is combining ketamine therapy and ketamine psychotherapy with some of the more well-known medication-assisted therapies, specifically Suboxone treatments. There has been research published recently talking about how the combination of Suboxone treatment with therapy and ketamine-assisted therapies show much greater results for long-term abstinence from opiates. There's studies coming out from Russia saying that ketamine is an effective way to curb alcoholism, which is huge in my addictions field, and I'm also an ex-alcoholic myself. So, I have a strong passion for helping these people, this class of people. But we're looking at helping heroin addiction. Helping people break through spiritually, helping with treatment-resistant depression, helping with treatment-resistant depression related to bipolar disorders, and also I've read some things on how clinicians use it as a means to partially understand the schizophrenic mind, which is pretty interesting as well.
So the clinicians are taking it to understand the states better?
Yes.
It's kind of like the early LSD research.
Absolutely.
There was a great talk at Horizons talking about like what therapists don't talk about, and it's kind of the history of therapists using these substances for their own psychological training and to maybe understand different states of consciousness and whatnot. So that's cool. I think have read some studies about ketamine being really good for almost like an intervention for severe depression and suicidality. Kind of can take somebody out of that state quickly. Do you understand like the mechanism that is like why it's so like why it's being examined so like therapeutically and has these clinical applications? Like what makes ketamine like a special intervention for some of these like disorders or
Sure, and that's not my expertise, so I'm going to try and do my best, but I'm sure I'm going to butcher it. I apologize to any of your listeners who are more knowledgeable on the chemical makeup. But as far as I've read and understood, it works within some of the same NMDA antagonist receptor sites as some of the other clinical drugs that help with opiate addiction, like methadone, Suboxone, Subutex, things like that. And I've read studies that suggest that maybe there's some actual brain rewiring going on while under the substance. But it starts to get a little technical, and my interests are more in some of the psychotherapeutic or psychological effects. So I don't spend as much time, reading and trying to memorize and remember the specific pathways. I believe that the mechanism of action is still being researched at this time. There's a bunch of different theories as to how it may be happening, kind of like with LSD, but no one
right.
really a firm grasp on it yet.
Cool. What about the psychological aspects?
Man, do you guys have any experience with it?
I've never never experimented with it outside of a hospital, for sure. I like that disassociative. So the story is your mind disassociates from body, and you have this kind of pure mind thing happening. So, what is that? And it's kind of interesting. It sounds like you kind of have this total decrease of anxiety as a result of that. So you have a period of time to be with your mind with no anxiety, and that's as far as I get conceptually with it.
Yeah. I think that's great. I think you're right on target. So how I would describe it is exactly that, with maybe a few more details. So because it is an anesthetic, but it keeps the mind pretty active. Someone could take a higher dose, hopefully. Higher doses are showing to be more effective therapeutically anyway. So taking a higher dose of an anesthetic, closing your eyes, laying in a soft, comfortable area, your mind does disassociate from your body. Your senses, because it's an anesthetic, kind of go away. You can't feel your body. It's totally numb. You feel like you're floating, kind of like if you're in a float tank, to the point where I believe your mind is no longer picking up sensory information from the exterior world. So with your eyes closed, with earplugs in, you're not taking any touch sensory information, tactile, you're not taking any auditory, you're not taking any visual sensory information, and this allows the brain or the mind to access a whole lot more free space to kind of work with itself. So usually we're taking in information all the time from all 5 of our senses, but with 4 of our senses gone, that one sense gets so much more working memory, to put it in computer terms, to work with. So that's what I've found anyway. I can go really deep into my mind to places where I couldn't if I was otherwise distracted by external stimuli. And that's different from other psychedelics because I'm still taking in external stimuli, even in a closed-eyed therapeutic LSD session or something. The ketamine just kind of cuts that off, which is something I really enjoy. And that anxiety piece, we hold a lot of anxiety in our body somatically. So when that connection is severed temporarily and the body is kind of shut off from the mind, all that anxiety that's held in the body is no longer playing an impact on the mind, and the mind is allowed to, really look at itself without this lens of anxiety to look through.
Is it like sensationally similar or substantially different, like the anxiety part, to like a benzodiazepine type anxiety reducer?
I would say it's actually pretty similar, because those benzos, they tend to give users the perception of a bit of numbing in their body, not like a tactile numbing, but kind of like an internal sensory numbing. Difficult to describe, but when you feel the anxiety inside your body, it's a very somatic sensory experience, and that's what's kind of numbed with the benzos. Whereas with the ketamine, definitely numbs those internal feelings, but it also, in my experience, has numbed external, tactile stimulation too. So I can be touching my own skin, or I can be touching the wall and not literally not feel it on my fingers, or be standing on some grass or a different kind of surface and not feel it under my feet. Yeah, that's where it's different from the benzos.
Interesting. And now, are there visual hallucinations that come with this? Are you kind of, I don't know, sort of detached, like outer body, where you're not, where you don't remember anything, or?
So I've had, I would say, 3 distinct types of experiences, and the set and setting has been different, and the intention been different for these 2, so that may have played a factor. On high doses of ketamine with eyes open, so you have an eyes opened experience. Yes, I have definite visual hallucinations, things that I've seen, and then also looked into, and that other people are reporting from their trip reports too. So there seems to be some consistency here. One of the most interesting things I've seen is when the world turns into sort of a Lego world. So you look at any surface and people, and you look at their faces, and everything seems to be made out of these little tiny building blocks that seem to fit together very harmoniously and move as objects move. So that's very interesting. I've also, been able to see, looking at my fiance under the influence of high doses of ketamine, she resembles a very much, a close depiction to like Gaia or Mother Earth. I see her motherly, or hopefully future motherly nature. Her spirit. It's very, very hallucinogenic for me with eyes open. Another experience I've had is the astral projection experience. This has primarily been closed-eyed sessions, laying down, or with my eyes open, maybe with the setting being black lights and stargazing, things like that. I'll have an out-of-body astral projection experience. And my third type of experience I've had with ketamine is a completely closed-eyed session, more in line with psychedelic psychotherapy protocols, with proper invocative music, nice safe setting, making sure I control for temperature, intention setting, all that kind of stuff going into it. And I have very distinct, very, very profound internal hallucinations, much more so profound in my experience than other substances like LSD or psilocybin, where that is more like working through trauma, whereas ketamine kind of transports me to a place where I get to see, all of reality as the machine that it is, and get to see my part in that. It's much more transcendental for me than the other ones.
Fascinating. Do you think you could give us like a report on maybe what like one of those therapeutic sessions was like for you?
Yeah, absolutely. So I will describe my last one, and it was 1 gram of ketamine intranasally, done all at once, 0.5 gram per nostril, intention setting, and setting where, we're set. Being an integration therapist, I kind of know what I particularly like in those settings. So it was set to my needs. Your listeners will need to, know themselves pretty well to set it for themselves. But yeah, it was pretty profound. So there's a few things that happened in my trip. One of which that I commonly see is I'll get this feeling that I'm sitting on the edge of a waterfall, and I believe it's called a caldera, those 360 waterfalls. You know what I'm talking about, with a big sinkhole. So I get the feeling that I'm kind of sitting on the edge of that, kind of floating. And then all of a sudden I get asked the question, do you want to go in? Do you want to go deeper? And I I assume this is, the ketamine asking me if I want to go into the K-hole. And so I say yes, and I let go. And the next thing I feel is, I'm laying on my back floating down the river towards the edge of this waterfall, and then my body elongates and my legs go over the waterfall and reach all the way down to the base while my upper body is still at the top of the waterfall, and then the rest of my body falls in. After that, it shows me any number of things, but in my last trip, it showed me kind of the deconstructive or spiraling nature of reality. I got to see all of life in the cosmos, to my family, my friends, little microcosms and little organisms, all kind of spiraling down in this life and death cycle towards a singularity. And in past ketamine trips, I'd always kind of resisted going into the singularity for, out of fear of actual death, fear that if I believe in the power of the mind and I let go completely, that my heart will stop or something. And so this time I went in with courage, and I had the same fears came up, and I just said to myself, well, if this is the time for me to go, this is the time, and I'm ready to see what's through the other side of this singularity. And I spiraled down kind of like a drain does in a shower, and then was sucked through to the other side. And it seemed kind of like some of the theories on what black holes might do, like a wormhole. So I popped through the other side, and then what I saw was exactly what my setting was initially. So I was in this therapeutic space with my computer and my altar and things like that before I had gone into the trip. And then on the other side of the singularity, I saw the same space, exactly the same, except everything was patterned, and all of a sudden I had this ability to move objects and move matter in my space with my mind, and having an ultimate connection to all these objects around me that in my normal waking life, most of the time I think in a dualistic way because of how I was raised. I try not to, but I do. But now all of a sudden I had complete control over matter and over my future and over the direction of my life. And I realized, I can do anything I want as long as I put in the effort and put in the time and put in the intention. And that was a message I brought back for myself. Another significant thing that happened during that trip, I asked this entity, this voice that I was hearing, which I assumed to be, the collective ego, the collective consciousness. I asked it to be able to be shown what the end looks like. And by the end, I mean the end of everything, the end of all existence, the end of this cycle of expansion and contraction that the universe is unfolding. And I really wanted to see the end. And so it showed me, and what it showed me was kind of like this, it zoomed me out to an objective third-person perspective and showed me that this kind of like this consciousness decided that it wanted to experience itself in an infinite number of physical ways. And that this was why, consciousness in every single person is experienced as subjective, but is just this larger consciousness experiencing itself through an infinite number of scenarios and an infinite number of potentialities in multiple dimensions, all happening at once, and that was its purpose in creation, was to experience that. And I thought that was pretty amazing. It gave me a brand new respect for other people's experience, that we're all experiencing the same thing, and it fed into the simulation theories that I've been reading about, how these simulations are being played out in an infinite number of ways towards a larger programming, and it showed me kind of itself folding in on itself, and it told me that it had a contract with itself. It said, I'm going to experience myself in an infinite number of ways, but as soon as that infinity is done and I've experienced myself every which way I can, I make a promise to just blip out and to not exist anymore. And it had made this contract and just kind of been okay with that. And I was like, okay, that makes sense. You can only experience this reality as much as you can, and then it's over.
Wow, that is fascinating.
How long did that last for you?
Oh man, I think I was probably under for 6 hours.
Wow.
That's wild.
Is it typically that long, or was that because it was a high dose?
Well, the higher dose puts me under for longer. But no, usually it's around 4 to 6 hours.
Wow. Wow. I thought it was a little bit fast acting. I've been around people that use ketamine, and I thought they would just kind of stay in those little K-holes for maybe like a few, I don't know, like 30, 40 minutes or so.
Well, part of my intention going in was to stay in it as long as possible. And I believe that my meditative practice and my mindfulness practice helped me to sustain that a little bit longer. I know that on smaller doses, back in the day when I was partying, little bumps of ketamine would wear off within like 45 minutes to an hour. But I wasn't very mindful at all with the youth. It was just a party drug.
Yeah. Wow, that sounds like a really amazing experience. So after having an experience like that and, being a clinician, like how do you think, or why do you think an experience like that is therapeutic for somebody?
Like for me personally or for anybody?
Yeah, like, just like your subjective experience of experiencing that and then applying that to like therapeutically, like why having an experience like that, like why would that help somebody with PTSD, depression, or anything along those lines?
Well, for other people, I would say, and for me too, I would say that having these transpersonal experiences, whether it's with ketamine or any other psychedelic, to put it in shortly, it kind of just lets you know that everything's going to be okay. That your daily troubles, your daily problems, your daily worries are really not that important in the global cosmic scheme of which you are a part of and which you will return to. Making a mistake in this life, it may haunt you for a little while, but, things are going to be okay. And this is just the smallest little sliver of existence. So then returning back to life, it kind of gave me the ability to let go of the small things that were bugging me, even let go of some big things and just realize, it'll work itself out. It'll be okay. We're all collectively as a species moving towards something. We think we're individuals moving towards individual goals, and we are, but all of our individual goals are playing into one larger human goal, and everything's going to be okay. So I think that helped with depressive symptoms. It also has helped me get over fear of death and being able to see that death is not an end to anything, but is simply a doorway to something much larger and greater. That I've done it before and I'll do it again, and that death is nothing to be feared, but is something to be celebrated. Just like birth, it's a passageway into a new experience in a new dimension, new universe.
Cool. So Joe just cut out, so I'm going to re-ask you this question. So people describe it's pretty common that people talk about a K-hole. Why do you think people use that term, and what does that really describe?
Okay. So I don't really know where that term came from or why people might actually use it, but from my own subjective experience through my ketamine use, as I described just before with, going over the waterfall into the caldera or going down this drain, it definitely feels like one is dropping into a hole within themselves. It feels like a definite drop, kind of like, when you're riding in a plane and you hit some turbulence and your stomach goes up to your, throat. It literally feels to me like that. So that may be where the name came from. But for me, part of my objective with all my ketamine use has been to get into the K-hole space. That's where I find the most insight, the most therapeutic benefit. The lower doses that don't produce the K-hole effect, they have shown in studies to be effective for minimal change, short-term change in some mental health issues, but the research is very clear showing that higher doses of ketamine the ones that do produce the K-hole full hallucinogenic effects are much more effective for long-term recovery from mental health issues, addiction issues. They've also shown through good science that repeated sessions, particularly 3 high-dose ketamine sessions, shows a lot more effectiveness than just one high-dose session. And definitely that, psychotherapy is integrated with all these sessions has been shown to be much more effective as far as for the subjective user to be able to use the insights and integrate it into their daily life.
Do you know how long the infusion experience is when they're getting it IV?
Well, I spoke with a clinician who does ketamine therapies here in my hometown, and we were just discussing his methods versus my methods, and I prefer intranasally for a variety of reasons, which we can get into. But he prefers the IV or intramuscular method. Intravenous or intramuscular method. He's a psychiatrist, and that may just be his affinity for that, but it tends to last, from what he said, from like an hour and a half to 2 hours. So it's pretty quick. You're in and out of the clinic within a couple hours with some therapy, some grounding stuff before and after as well. I personally don't mean to get sidetracked here, but I personally like the intranasal method, especially for its use in the addictions field, because if it is useful for addicts to decondition themselves from taking a pill or taking intravenous drugs by doing these medications intranasally, where that may not be a trigger for them, I feel like it could be more effective. Whereas if an addict was their preferred mode of administration of their drug of choice is intranasally, then we might want to check into intramuscular, intravenous treatments for these types of clients. So I think that the method of delivery is also pretty important and probably hasn't been studied to the extent that it needs to be.
Joe, you're saying something. Somebody at Horizons brought that up.
Yeah. So the clinician actually that I was talking to said that in her practice, she's actually using it intranasally. She's not doing high doses. It's kind of like a saline solution. It would be really interesting to see. Obviously people are typically putting it in their nose as a powder, but the saline solution method would seem like a really interesting dilemma. Her only criticism was that the turn and burn aspect of it, and kind of maybe there being some sort of market abuse in those segments, but. We didn't talk for too long. It was only a couple minutes, so I didn't get more in depth with the major differences. Typically I think what's it called? Encephalation? Is that the
insufflation?
Insufflation. Mm-hmm. It doesn't sound like it doesn't sound slow. It sounds like onset's really quick. I know IV onset's really quick as well. In a lot of ways, I think if you don't have to put a needle in someone's arm, why go through with that? It's not risk free. Even doing a blood draw, that's not risk free. So if it's do no harm, that's the first thing, then let's start with the least harmful administration methods. It would be interesting to see how you could, Are you familiar with, Shane? So a saline solution ketamine mix, so instead of the powdered solution?
For insufflation?
Right.
No, I'm not familiar with that. Just with the powder solution.
Right.
But I know with the IV methods, with using those high-tech anesthesia machines, that the doctors can control the level of ketamine in the bloodstream a lot more easily and a lot more calculated than you could if you're doing intranasal. I know that the onset from my intranasal experiences is pretty quick. Within 5 to 10 minutes, I'm already beginning to feel effects.
Right. Yeah. Part per million, you can really dial that in with those.
Yeah.
I would love to get the technical term for those machines. I've been kind of struggling with that for a while. I feel like it's an infusion device or something.
Like anaphoresis machine, or I don't know. We're totally butchering it right now.
Yeah. So someone send us a message on that. Because I know at least one of you knows the answer on that. So do you see any pitfalls in this ketamine world? So it is the addictive psychedelic.
Yes.
I'm seeing it a lot in the party world. I think people are having a lot of kidney issues. Is it kidney or bladder?
Bladder, usually.
Yeah, bladder.
Yeah, sorry. I take that thing back about kidney. Bladder. It's also something you want to hold on to, just like your kidneys. Is it like... from what I recall, it was like some sort of... It's the excretion pathway, and it crystallizes in the bladder, causing damage. Is that way off?
I'm not sure about the specifics around that, but it's well documented that long-term high-dose ketamine use, and I need to define that first. So long-term consistent ketamine use at high dose means over 1 gram per day over the period of years.
Whoa, that's intense.
And that's... Yeah, that those high levels over that long period of time does cause serious urinary tract issues, to the point where some addicts have had to have their entire urinary tract and bladders removed.
Wow.
And then they're peeing into a bag for the rest of their life because of this, and it's irreversible. So yes, there are some significant dangers associated with inappropriate use of ketamine. Illicit use is mostly where these issues happen. But you're right, ketamine is the addictive psychedelic. It does have a higher addictive profile than any other psychedelic. It still doesn't have the same addictive profile as, say, heroin, cocaine, methamphetamine, alcohol, drugs like that, tobacco. But it is the most addictive of the psychedelics, and it can be abused. They're finding a lot less abuse if people are seeking it out for therapeutic means through the appropriate channels, like these ketamine assisted psychotherapy clinics. And more problems are coming from people getting their drugs off the streets. But I feel like that's an issue with any drug that, in the research, it can be great with MDMA and with LSD and stuff. It's great, but you always take a risk of potential negative consequences if you're getting your drugs off the street. There's a behavior associated with that sort of drug seeking.
Yeah. So I just saw this article today on Medscape, and it's just about the concerns, and it was written by Dr. Jeffrey Lieberman of Columbia University. And the article just said, my comments today could be called when clinical practice leaps ahead of research and evidence. So it was really kind of calling out some of these questionable ketamine clinics, and that, what's going on there could kind of damage the field of psychiatry if we're moving ahead of the research and just kind of jumping on these bandwagons right away. But yeah, I think it is interesting. It seems pretty safe besides the high dose kidney or bladder thing, but also, it's interesting when this new research comes out and people want to jump on board and maybe not really fully understand it.
Sure. And when we're talking about it being of the more dangerous psychedelics, I feel like we're still painting it with a negative picture, and we need to clarify to your listeners that even though it's on the higher end of danger in the psychedelic scale, when compared to all drugs of abuse and all drugs of addiction, it's still on the lower end of that. It's just one of the more dangerous psychedelics. much less dangerous, though, than, like I said before, any other anesthetic, because it keeps your heart rate and keeps your breathing normal at very high dose. So it is one of the safest anesthetics. But it's also one of the more dangerous psychedelics. But it's also one of the most safest addictive substances. So we have to make sure that the entire context is presented there, so that people can have a good impression of what ketamine is and what it can do, what the potentials are with it if not abused.
I pulled up the David Nutt harm scale here. Classic metric. So more dangerous than ketamine on this scale. GHB, cannabis, amphetamine, Adderall, tobacco, and alcohol, all more dangerous than ketamine. Less dangerous.
Cannabis, really?
Well, on his scale, yeah. Might impact your salary, stuff like that. Just kidding. Just kidding. Less dangerous. Butane. That's crazy. I didn't know people were abusing butane. Anabolic steroids, ecstasy, LSD, mushrooms. Buprenorphine. Is that?
Buprenorphine. That's Suboxone. That's it's opiate antagonist medication. That's what we use in our clinic here. Medication-assisted therapy is Subutex or Suboxone, which is buprenorphine.
Cool.
It's a partial opiate antagonist, so it helps block some of the opiate receptors and fill those up. It helps people with acute withdrawal, and in our clinic anyway, coupled with a behavioral component, we're trying to get these opiate addicts off the drugs long term, including off the buprenorphine.
Absolutely. Yeah, I really like the idea of this being able to pull somebody out of the depressive state so you could actually begin to do work with them. So say for instance, you were at a week-long retreat or something, they could get it like twice at the beginning, maybe, and then do a bunch of breath work and talk therapy or something, and maybe some group therapy work, and maybe one final treatment at the end. And then, good luck. Hopefully there's some follow-up after that. But that seems like something that could work in terms of like a immersive residential treatment program for ketamine. Actually, that's a good question. Do you know if there's residential programs with ketamine?
That would be a great... no, I don't know. But that would be a great idea. Yeah, I wonder, it'd be interesting if there are some sort of retreat clinics, if not in this country, maybe in some other country, being that the World Health Organization, or I don't know if that was the organization you mentioned earlier, but they recognize it as one of the most beneficial treatments. It'd be interesting. I wonder if they have like retreat centers, kind of like, the ayahuasca centers in Peru and things like that, where you can go for a week and get your ketamine infusions.
That would be really interesting.
I think
it was the World Health Organization.
45 miles out of Nashville. So fun on both sides.
Mm-hmm.
Interesting. Yeah, they have other places too, but yeah, so it seems like somebody's on top of that, which is great. So yeah, somebody with like really acute symptoms, and I think that would be really an interesting way to go about it.
Yeah, well, the research is extremely clear on those, particularly that treatment-resistant mental health disorders, ketamine helps with an immediate breakthrough. But also, I read last night in an article that it's also very effective in engaging clients who are extremely defensive around their treatment. So if they have very strong defense mechanisms up, and a psychologist or a psychotherapist like myself cannot get through to that individual to begin the healing process, sometimes a ketamine therapy session can help just shatter those walls of defensive,ness and open these people back up to themselves, but open them up to the clinicians too, so that they can accept that help. You guys know we get in our own way most of the time. That's our biggest issue. We get in our own way, and we prevent ourselves from living our own potentials.
Definitely. Yeah, we definitely do that. Sorry, just based on what I was going to say or ask.
if any of your listeners are interested, there's a great book out called The Ketamine Papers. I just picked it up a little while ago, and I've been reading it. It's a fantastic overview of ketamine, not only its history and its clinical use, but it goes over, some very interesting trip reports from, first-person journey accounts from people like Dr. Stan Groff, Dr. Ralph Metzner. It talks about the abuse history with ketamine with some of the more famous abusers. There's actually some famous ketamine abusers out there. If you guys have heard of John Lilly, and his kind of journey through ketamine and his journey into psychosis, or some people would say psychosis, where he felt he was communicating directly with dolphins and getting premonitions of future historical events and things like that. So I think it paints a very good picture, a broad picture of ketamine and kind of where it's come since its inception.
Well, that just came out in the past year or two, correct? It's pretty new publication.
I think about 9 months ago, if memory serves me.
Yeah, it says 2016 maps. So your listeners can get it through the MAPS website, probably at a discount too.
Yeah, we'll link to that. It's I think it's pretty groundbreaking work. I feel negligent for not having read it yet. And I had no idea Groff contributed, but that makes a lot of sense that he did.
Mm-hmm. Yeah, well, the more I looked into it, the Esalen Institute out in California, they were experimenting with such a wide range of therapeutic modalities and different medicines, especially back in its early days. I would have loved to have been at that place. Have you guys, either one of you guys, visited the Esalen Institute?
I've driven by it 3 times on the Big Sur coast. I never had the guts to go in because I didn't have an appointment. Kyle, you've been though, right?
I did. Yeah, I've been there before. I went for a weekend workshop for spiritual emergence. I forget what the actual title was, but it was with David Lukoff and Michael Cornwall. So we had actually went over a little bit of the history of like the spiritual emergence topic of how it kind of formed there, and like some of these cool studies that kind of came out of Esalen. Esalen, I believe, like helped fund or was part of this huge coming off like psych med study. They're just showing like the I'm butchering this right now because I forget what it was about, but just showing that like the difference between people on medication for schizophrenia versus off of it.
It sounds to me to be like almost kind of setting up the premise for that spiritual emergency network concept, or like setting up.
That's where it started,
right?
Mm-hmm. Yeah, and they started out with the retreat model. People could go and get their spiritual treatments through a variety of medicines and treat mental health issues that were treatment resistant. We need more places like the Esalen Institute.
Absolutely. I would love to see one in Colorado. It'd be beautiful if I could just drive down the road somewhere. 4-hour drive or less would be wonderful.
There are some folks that were there from Colorado. They worked for the Windhorse Institute, which was kind of like they help people with like extreme states, but it's not residential. They do more, I think, like outpatient work.
Buddhist psychotherapy.
Okay, so it was the Agnew study. It was a research study. Biggest of its kind for first break psychosis. That's what it was. Yeah. And Dick Price helped kind of like push that movement a little bit, which is really interesting. Some really cool stuff came out of Esalen.
I didn't realize he was a co-founder. I thought it was all Michael Murphy. But that's interesting.
Dick Price and Michael Murphy. Yeah. If you haven't been, definitely go check it out. Hot tubs are amazing.
Shane, have you been?
I have not. That's one of my bucket lists. I want to set up a road trip across the country sometime and hit all the psychedelic hotspots that have significant history, and that's definitely one of them.
Yeah, they used to do those month-long breathwork retreats, and I couldn't imagine how great that would be. So this is kind of not necessarily attainable, but I feel like a month-long retreat center dealing with specifically people with real problems that were able to get away for a whole month of breath work or something. I think that would be fantastic. I don't know if we talked to you about this, but there's a place in Las Vegas called Holistic House, and they take in people after they come back from Mexico for Ibogaine treatment. Specifically, I think they only work with people suffering addiction. So what they do is kind of help to imprint healthy habits and patterns, and kind of provide a non-drug safe landing space before they go home.
Yeah, so we have models like that in the addiction field right now, kind of like transitional or halfway houses. In my own treatment experience, I went through a 30-day inpatient followed by a 90-day like a follow-up treatment out in California, and a third stage of that program is to go to a transitional housing, or sober house, where everyone in the house is sober. You're all learning how to pay bills again. You're learning how to go grocery shopping. You're relearning how to live life sober around other sober people. That sounds great, and I think we need more centers like that in Vegas, because I've been hearing a lot of people coming back from those Ibogaine or ayahuasca ceremonies, and then not being able to integrate very well back into their everyday life. So having that sort of transitional space, that sounds very promising to have that formalized.
Yeah, absolutely. The guy that runs it, we're going to have him on the show in the near future, I hope. He's been a DJ for HBO forever with the boxing matches in Vegas. I think that's his professional gig, and which is interesting. And yeah, as a result, he went through the ringer himself, and I think he's pretty public about it. And now he's doing the work with other folks, which is pretty cool. A real convert to Ibogaine. Really tangential to ketamine, but it's just this interesting idea of a nice safe landing space.
Sure, and not as tangential as you may think. These substances are all. They're showing great effectiveness with all sorts of addictions, and for some people, the Ibogaine experience, which is extremely intense and extremely taxing on the body, lots and lots of purging, very uncomfortable. For people who may not want to go through that type of experience, may find, a different avenue in ketamine-assisted therapies. There can be some nausea and stuff associated, but not at the level even close of Ibogaine and some of the other psychedelics.
Where would somebody find ketamine assisted therapy for addiction? Would it be any type of ketamine clinic around the country, or do you know of a specific place that's doing that and offering those services?
I don't know a specific place that is targeting just addiction. The places here around me are targeting any number of things. They're targeting addiction. They're targeting mental health disorders. They're targeting spiritual disorders. They're targeting just the general public for people who want to keep their spiritual practice, very, very present, very salient in their life right now. But I do know that it is being used for addiction, specifically with opiates and alcoholism. That's where most of the studies that I've found are coming out for, and showing great results. So if anyone wants to know where ketamine-assisted therapies would be for addiction, I would probably just Google it. I'm sure that there are these sort of in and out type clinics. I would do your research if you're looking into it, and I would definitely highly suggest, as a clinician and as a practitioner with ketamine, I would highly suggest that if you're interested in getting ketamine therapies, go with a model that is more closely related to the psychedelic therapy model, where there's pre-psychotherapeutic sessions to set your mind up and get it ready for this experience, because it's extremely powerful. That it has a good clinician that you've built a rapport with and that you trust while you're under the influence of ketamine, and then that also has post-session therapy as part of whatever package they're offering. The integration piece with the psychotherapy, in my opinion, as a clinician, is as important, if not more important than the psychedelic experience itself. You can have the most mind-blowing psychedelic transformation experience in the world, but without learning how to integrate that into your daily actions to improve your life, it's just going to be a memory. It's just going to be a forgotten experience. So please, people, find the right models. These models are based on evidence.
Yeah, and I think going back to that article I brought up about like concerns with ketamine, was really just based around some of these clinics that are popping up that are doing like really quick doses in a short amount of time. So it's like probably, I think it's at like 10 in like a couple weeks, and I don't think like doing any sort of therapy, just kind of getting people in and out. Yeah, I think that doctor is kind of calling out those clinics.
Sure.
And it's interesting, right? Because it is still effective in that context, right? It's just it could be disruptive to the person's life, like by having this super strange experience and then all of a sudden come back to it. But yeah, it's something we do need to discuss, because like Shane said at the beginning, this is about optimization of treatment. It's not necessarily about turn and burn.
And I think it's really like applicable to the psychedelic movement. I mean, we could see stuff like that happen if some of these substances get rescheduled. Like maybe you could see some centers pop up that just give you an experience and let you go without, like, say, that therapeutic approach where you're doing preparation, integration, and all that stuff.
Yeah. So we're at about time. Shane, is there anything else you want to throw in?
No, I just want to thank you guys again so much for having me on. It's always a pleasure to not only speak with you guys and your audience through this means, but to be able to see and speak with you guys in person, when we meet up in Boulder or whatever, and happen to see each other at events. I want to thank your audience for listening and continue to listen, and encourage them to reach out if they have any additional questions. I'm sure, there's a lot more questions left unanswered. So these guys will put up some of my information. You can contact me through my website or through my email. And I'll do my best to answer questions from my own experience, but I'm not an expert by any means. I'm hoping to become someday, but not yet.
And what's your website, really quick?
So my website is www.mindops.com. So it's mind-ops.com. And on there, you'll find, my private psychotherapeutic practice, where I do addictions counseling, sport and performance optimization through mental training, and also do my general psychotherapy practice. But if any of your listeners are interested in psychedelic integration therapy, I also offer that. It's just not advertised on my website. I am on the MAPS official list for that. So I just want to thank you guys, and thanks for providing this sacred space to be able to talk about a medicine that isn't talked about as much as it should be.
Well, thanks for your time, Shane. We really appreciate it. It's a lot of valuable insight, and firsthand opinion matters. Firsthand accounts matter. I think a lot of the value in this work gets lost in the numbers. This isn't necessarily just a numbers game. I've been reading a lot of Oliver Sacks lately, and there's so much story and humanness to this stuff that we can bring to the table here. So thank you. I hope you really enjoyed that episode with Shane LeMaster. Shane is awesome, and he's really helpful for us to provide some firsthand information, clinical experience, kind of journey work experience sometimes, and really happy to have him as a friend of the show, and really look forward to collaborating with him more in the future. So yeah, if you have any questions about that for us, about that episode for us, you can reach out to us, psychedelicstoday, email@gmail.com, psychedelicstoday.com/contact us. So yeah, feel free to reach out, and we're happy to talk. And we always are looking for suggestions for the show. If you want to support the show, give us a review on Facebook, iTunes, tell your friends, maybe check out some of our t-shirts we got at psychedelicstodayshop.com. And yeah, we got all sorts of stuff there now. So check that out. You might like some of the stuff. There's stickers available, all that kind of stuff. We also have a Patreon we're launching. So if you want to contribute $2 a month or more, that would be super helpful, because we are trying to keep the lights on over here and be able to afford to keep this show going. So really hope you enjoyed the episode, everybody. Let us know what you think. Tell your friends. Love you. Bye.